Hi, I'm Samantha Mango. Welcome to Sullivan 180 Presents Take 5. Our guest today is Haley Motola from Sullivan County Public Health Services. Welcome, Haley. Thanks for being here.
Thank you for having me.
Pleasure. Can you please introduce yourself, give us a description of your role at Public Health?
Yep. So my name's Haley Motola. I'm an epidemiologist for Sullivan County Public Health Services. So besides the usual work that I do on communicable and reportable diseases, for COVID, which I know is what most people are thinking of right now, I kind of oversee a lot of the case investigating, the contact tracing, statistics, geographic location, hotspots, as well as any logistical findings that could help prevent the spread of COVID.
Great. So you've been really busy.
Very.
Can you talk about the current vaccination rates in Sullivan County and tell us why it's so important to get those rates up?
Yep, definitely. So about 58.2% of our county is fully vaccinated, and that includes those that are not yet eligible. So that's the entire population, including kids under 12 and those who can't get vaccinated. So for those who are 18 and older, we're at 69.9% as of today of people who are vaccinated. So we're getting there, but it's super important to keep working towards an even higher number. So it's vital that people get vaccinated in order to really stop the spread of COVID-19 and keep people safe. So you're more likely to be hospitalized if you're unvaccinated and more likely to die from COVID-19 if you are unvaccinated.
And who is currently eligible for vaccinations? And I'm also asking this to include the booster shots that were just recently approved.
So for just a regular COVID vaccine, not the booster, it's anybody 12 and up right now. And for those that are boosters, so for booster shots, it's anybody 65 years and older who received Pfizer. Right now, we don't have any guidance from the state on Moderna or using Pfizer if you have Moderna. So right now, it's just people who had Pfizer, and it's the Pfizer booster. So you have to have had Pfizer, been 65 or older, and had the vaccine at least 6 months ago. And for those aged 50 to 64, that have an underlying medical condition, you had to have had Pfizer at least 6 months ago. And for those 18 to 49, you have to have an underlying condition and had Pfizer at least 6 months ago. And the same for those 18 to 64 who received Pfizer at least 6 months ago and who are at an increased risk of either due to occupational or institutional settings, like being an essential worker, or living in a congregate setting, being around people who are immunocompromised, or anything that you have to be within closer than 6 feet, due to a job or caring for somebody.
And where can people get their vaccination shots?
So right now, next week, we are offering a clinic. So from 10 to 1 at Public Health, we're doing boosters, and then 2 to 6 for first dose, second dose, and boosters. You can also go to vaccines.gov and just type in your location and find the nearest place to get vaccinated.
Great. Are you doing the clinics every Wednesday?
Yep, every Wednesday, 2 to 6.
And is that at the public health offices in Liberty?
Yep.
This was not part of our questions, but what would you tell someone who is still hesitant to get their vaccination?
So if someone is hesitant to get their vaccine, I would say call the office and just ask to speak to me. I would love to talk to somebody. If someone's on the fence, I will talk to them one-on-one and answer any question, non-biased, no judgment. And feel free to call and just ask for me, say that you're hesitant about getting the vaccine for whatever reason. And I'd gladly talk them through the stats and the science of everything.
And what number can they call you at?
845-292-5910.
Great. Thank you so much for that. Is there anything else that you'd like to share?
Really just an extremely big thank you to all the people who work at Public Health, all those that have volunteered, my amazing team of public health workers, staff, and incredible nurses that I work with every day. So big thank you to everybody, and a thank you to Sullivan 180 for all the work you guys do.
Oh, thank you guys. You guys have been tremendous. You've been working so hard, and we appreciate it.
Thank you so much.
Thanks for joining us today, Haley. We appreciate you and we appreciate Sullivan County Public Health, and thanks for helping Sullivan 180 build a healthy community.
Well, thank you so much for having me.